Tell me about your role with the Trailblazer.
I co-chair with my colleague Kay on 3 Apprenticeship Standards. We've been working with our employers for 20 months.
I'm really passionate about development and education for the qualified but unregistered workforce, and so apprenticeships are a really great way of doing that for people. The best part, I think, has been working with the energy and the enthusiasm of the employers that we've got around the table, who are really keen to see this apply in their sector and their area for their staff.
So it's been a very positive experience overall. Certainly from a military side, we haven't in the past engaged that much with the NHS, although we work in the clinical settings with the NHS. Certainly from an education and training perspective, we haven't done. So this has been sort of a big step forward actually in having.
So the best bit of being part of the Trailblazer then is working with a great group of employers who come together regularly, the fantastic support that we've had from Skills for Health.
Well, I think we've worked really hard to say what's really, really core to these jobs. What's so important that we can't leave it out. And also, we've been very good around being succinct about our words, which isn't always the case.
Agreeing standards for all workers. So, obviously we're not just looking at the single pathway, but also even within the single pathway, being able to agree the standards and what everyone perceives to be that role, and agreeing what the core ones are really. So
I think the most challenging so far has been, I suppose, coming up with the new standards and assessment framework is really thinking, is this going to fit the bill? Is it completely fit for purpose? Are the people who are going to be using this going to be totally satisfied with the end product and all the efforts that we've put into it? I think they will be. I think it's a fantastic product we've produced, but there's always that, I suppose, that niggle really, whether or not you're not going to be able to please everybody, I suppose, and that's always going to be the challenge.
I think by being really open with each other about what we do understand and what we don't understand, we've got a group of employers who have worked so well together, and we've developed a high level of trust. There's really open dialogue and we're open to challenge. We've had excellent support from Skills for Health and also from Talent for Care in terms of managing the group and supporting the group and keeping them together. And we've also been able to bring in different levels of expertise when we've needed them to guide us through different phases in the development of the standards. In particular, our colleagues from Skills Funding Agency.
It's having that open forum, the transparency, and also working with all of our key stakeholders really.
The changes will all come in around about the same time, so we'll have a sea of change really, not just the new apprenticeship standards, but also we'll have the levy coming out.
Levy already has brought a greater attention to apprenticeships within our trust, and people are beginning to take it on board and understand it. I think it's pushing and driving people that way. So I think that can only be a positive to get a better understanding of apprenticeships, and that means that we will consider more of the opportunities in new Band 2 posts and how they could be used more as an apprenticeship post.
So I think there's some real excitement about how we engage with young people and bring them into the workforce. That through apprenticeship development pathways we can begin to show that there's real progression and that people can learn while they earn.
I think sort of with the Trailblazer we're encouraging more apprenticeships across the patch, so I think more people will get on board with that and consider it.
I think, again, from the military perspective, this is a great opportunity for all of our servicemen and women to get recognition for what they've done, and then actually is a stepping stone then for further career progression, whatever they want to do.
I think the excitement is going to be seeing people coming out of the end of the apprenticeships we've developed here and seeing them feel like they've made their first steps in a career in care that allows them to be valued.